Hey there. Today we're going to talk about clinical trials for the treatment of lung cancer tailored to your experiences as Black patients. Because having people from different backgrounds in clinical trials matters. We understand that clinical trials can seem scary, so let's talk about them. Most clinical trials compare new treatments to the current standard treatment that is the best treatment currently available, not to lesser treatments. You may be getting access to treatments not yet available to the public. Your healthcare team is committed to your well-being. But what about the different types of clinical trials? Well, there are 3 phases: Phase 1, Phase 2, and Phase 3. Phase 1 trials are like the early tests, checking the safety of new treatments. Phase 2 trials focus on how well those treatments work. And Phase 3 trials compare them to the current standard treatment, also known as standard of care. We want you to understand that in clinical trials, safety is the most important thing. Before any new treatment is given to humans, it's tested many times in animals. And here's something empowering. You can choose to be part of a clinical trial, even if your doctor hasn't mentioned this to you. You can ask your doctor about clinical trials. Information on clinical trials is available online and through patients' advocacy groups. As long as you meet the trial's criteria, it's your decision. Think of it like a bridge to an exciting new treatment for your cancer. Clinical trials help us figure out if one treatment is better than another. And let's clear up a common myth. Clinical trials rarely use treatments that are not active, commonly known as placebo or sugar pills. In most trials, you will be receiving an active treatment, and you will usually know what treatments you're receiving. You will be given detailed information on every study that is offered to you. The choice to participate in a clinical trial is completely yours. Participation is voluntary. If you decide a clinical trial isn't right for you, you can leave at any time without consequences, even after signing the informed consent. You can join a clinical trial at any point in your treatment journey, even at the beginning. Detailed information about clinical trials is just a click away on clinicaltrials.gov, a government website. It contains a lot of information for you to learn more. Information on the steps to find a clinical trial is also available at cancer.gov/research/participate/clinical-trials-search/steps. Now, here's the exciting part. Participating in a clinical trial can give you access to new, cutting-edge treatments that may not be available elsewhere. And guess what? Most drugs are provided to you at no cost. You should ask the research team about costs involved when participating in a study. We know you may have fears about enrolling in a clinical trial, perhaps because of things done in research in the past that were morally wrong. Let's address that troubling chapter because it's important for you to know how far we've come. You might have heard about the Tuskegee syphilis study. In 1932, the U.S. Public Health Service, in collaboration with the Tuskegee Institute, started a study to understand what syphilis does to a person over time. The study involved Black men with syphilis, and the researchers did not provide syphilis treatment after it became available 8 years after the study's start. The study was forced to end in 1972 by the government because it was morally wrong not to provide available syphilis treatment. Our goal is to provide you with the information you need so you can make the best decisions for your health. A lot has changed since then. There are several steps in place to protect people in clinical trials. All researchers go through ethical training, and all clinical trials are reviewed and monitored by boards to make sure they are done in a way that protects people. These boards also have people from the community. We've come a long way since the past, and we're here to empower you with knowledge. Clinical trials are for everyone. Regardless of the stage of your cancer and how your treatment is going, there may be a trial that is good for you. Remember, representation in clinical trials matters. Why? Because Black patients tend to get sicker when diagnosed with cancer. We need to improve the access to newer and potentially better cancer treatments. Representation in clinical trials allow us to learn if a treatment works across a diverse patient population. Your participation will help others in the future. Together, we can bridge the gap to a future with better treatments for lung cancer. Clinical trials can show if a treatment is better. If you participate, you can help improve the knowledge in lung cancer research and offer hope for a brighter future. You have the power to decide about taking part on a clinical trial. Talk to your doctor about clinical trials and visit clinicaltrials.gov today and take control of your health journey.